Growing up, I always knew that there was something different about my body. I was dealing with autonomic and nervous system issues that only seemed to intensify as I got a bit older. As a young adult, fainting spells became a regular occurrence, and I started noticing troubling symptoms like motion sickness in the car and vertigo that would leave me feeling disoriented and unsteady. I remember one particular moment during preschool that should have been a clue about what I was experiencing was when we had a lab in neuro, and it was about vertigo. And at the time, I volunteered to be the guinea pig for class, and I had my classmates use me as a demonstration. So at the time, what should have been just a routine educational experience turned into something that was much more intense for me. I remember being in front of the entire class as a few of my classmates performed the vestibular testing. And I remember feeling as though I was honestly in a tornado. And I remember feeling a bit embarrassed in that moment because I was in front of my whole entire class and I felt sick to my stomach. I felt like I was spitting and I didn't know that I was going to have the reaction that I had. So it definitely was more severe of an experience than what even my classmates were anticipating. And that was during my second year of preschool. But it wasn't until my third clinical rotation that everything changed. My clinical instructor at the time, and honestly my mentor during that rotation, was planning to perform some cervical and thoracic spine manipulations on me just as a part of my overall learning experience so that I would be well equipped to performing these techniques on patients that would come in. So following just standard protocol, she began with a battery of neurological tests. So it was the same exact test in neurological screening that, again, was the same comprehensive assessment that we would perform with all of our patients prior to any sort of cervical, thoracic, or even lumbar manipulation. Initially, I really wasn't too concerned. It felt very reasonable that she was going to do a neuro screen on me so that I had a better understanding of how to do this on the patients that were walking, through the doors. Again, this was all just routine. But as she worked through the examination, I watched her expression grow more serious. I remember starting off with reflex testing, and across the board, all of my reflexes were hyperreflexive. Again, across upper extremity and lower extremity. And I was thinking, okay, no big deal. I told myself, it's okay. Just try to stay calm. Just go through the assessment. So then dermatome testing was next, which came back normal. So that was reassuring. And then myotomal testing was next. And again, not too concerning, but I remember having some weakness on the right side of my body compared to the left. And a little bit of worry began forming kind of in the pit of my stomach, honestly. So then my instructor began some clonus testing, which revealed abnormal responses in both of my ankles, with my right side being significantly worse than my left. So I had multiple beats of clonus, and my clinical training and just all the things that we learned in school, I found myself thinking, okay, this is indicative of an upper motor neuron lesion. I didn't say anything at the time. I was just thinking to myself. But my CI remained silent, just methodically working through each test without any commentary, which I think at the time probably heightened my anxiety a little bit. And then came the Hoffman's test, which was positive. And then the Babinski test, which was also positive. So each positive finding was like finding another piece of the puzzle that I didn't want to see completed. When she had me stand to do a Romberg balance test. I remember her bringing over another therapy in the clinic, and I nearly fell over during this testing. And I remember thinking, wow, I've never really tried this before. And this test, if you guys are familiar with it, it's performed with your eyes open and your eyes closed. And I remember, wow, if I'm almost falling over and my eyes aren't even closed yet, like, what does this mean? So then after this, my clinical instructor looked at me with a mixture of concern but professionalism and said, all of these findings clustered together might be indicative of a neurological condition. And then she said, you probably need to see a neurologist. So those words hit me hard, right? Fear washed over me. This wasn't supposed to be happening to me. I was a third-year physical therapy student, and I was supposed to be learning how to help other people and discovering that I might have to find ways to help myself. At the time, I scheduled an appointment with my PCP. I scheduled an appointment with a physiatrist. I scheduled an appointment with a neurologist. I had to wait 8 months to finally see the neurologist, and that wait felt endless. 8 months stretched before me, filled with uncertainty and growing anxiety. And I remember when I finally got to the appointment, the neurologist delivered what felt like a devastating blow. And I remember the neurologist saying, you likely have multiple sclerosis. And I remember telling this to my family, to my sister, and it was devastating. He told me, well, we don't know for sure. We have to get some, medical tests done. I had multiple MRIs. I had evoked potential testing, and each one was, just giving more clarity onto the current situation that I was in and the symptoms that I was having to really uncover what was going on. So during these battery of tests that I went through, I had a follow-up with the neurologist. And actually my final diagnosis was a little bit relieving, but then also I had a new source of fear and uncertainty. So the neurologist told me that I had Arlo-Chiari malformation and syringomyelia. And at the time, I really had no idea the extent of the symptoms that I would have with these diagnoses. I remember learning it in school, of course, but it wasn't personal until that day. I learned that a syrinx develops when there's inside the spinal cord and it disrupts your cerebrospinal fluid. And essentially what happens is that there's an accumulation of this CSF in the spinal cord tissue. And as the syrinx expands, it compresses and then it damages the surrounding nerve tissue, which interferes with nerve signal transmission. So the damage to the upper motor neurons, those nerve cells that carry signals from the brain to the muscles, or the, again, interference with the central nervous system was the root cause of my hyperreflexia, the clonus that I was having, the balance issues that I was experiencing. Those led to all of the findings that my clinical instructor found during my neurological screening. So then all of those positive neurological tests, again, it finally made sense to me. But then came the part that I really wasn't ready for. That neurology appointment lasted probably 5 minutes, honestly, which was disappointing in itself. But I remember the neurologist looking at me and said, you should stop working out. You should stop lifting heavy. You need to be careful with all movements. I remember he told me that I needed to be careful if I were to become ill, making sure that I'm careful with coughing and sneezing, because I could make my situation worse and I could become paralyzed. And I felt my world stop. And again, here I was training to become a physical therapist. And at the time I was very active. I enjoyed working out. And my doctor told me that I had to pretty much stop everything. And during that time, he also told me that I probably should stop pursuing a career in physical therapy, which I thought was crazy at the time. He told me that I should reconsider finishing physical therapy school because he didn't know if I would physically be able to keep up with the demands of the job. I remember leaving that appointment feeling helpless and literally feeling like I didn't know what to do for the rest of my life. And at the time, too, which really changed the trajectory of even my physical therapy specialization into pelvic health, was that he told me at some point in my life that I would likely have bowel and bladder issues. And that really, of course, concerned me, right? But instead of being super discouraged by those words, it really ignited something in me. I became really obsessed with understanding the pelvic floor and understanding that there was a subspecialty of physical therapy. So again, at the time, this was, I don't even know, 10, 12 years ago, there wasn't many pelvic floor physical therapists. I actually didn't know any at the time. I remember there was a one hour lecture at AIC where we went to physical therapy school, and there was a pelvic floor therapist in Connecticut that lectured. And again, she didn't really talk about this stuff. She didn't talk about how somebody could have a neurological condition and have potential pelvic floor issues. So I used that as fuel to learn everything that I could about pelvic floor so that not only I could help myself, but eventually be able to help others who might face similar struggles. And in that moment of fear and uncertainty, it really became the catalyst for my specialization and wanting to become a pelvic floor therapist. So, what really started as, I guess, a personal necessity of understanding my own body and its limitations, it really evolved into a passion for helping others navigate, similar symptoms and struggles with their own pelvic floor health. And it's something that really transformed my ability to be a physical therapist, because when I first started, I maybe almost felt bad or guilty because I felt as though because there was something that I was struggling with that I wouldn't be able to be a good physical therapist. I remember for many years I would wear a brace, so I would wear an AFO on my right side for a foot drop and to control some of the clonus that I was having with walking. And I remember going to work and opening the door to a new evaluation. And when I introduced myself to this individual, instead of saying hi back, he actually said, "Oh," he looked down at my AFO and said, "Oh, why did I get the messed up PT?" And that took me back. And I remember in that moment just feeling really isolated and thinking back to that neurology appointment and thinking, is this really what my life is going to be like? And instead of using that as fear or, not continuing the path that I was on, I led with, this makes me a better physical therapist because I truly understand what it means to be on both sides of the patient and provider relationship. And it's something that, I always remember that these diagnoses that are not easy to see, at the time I was 23 years old and I looked okay and I didn't look like I was struggling with anything from a physical standpoint. I use that as fuel to be a better PT. And I just wanted to share a little bit of that journey with you guys because a lot of my patients even ask me to this day, like, why do you do pelvic floor therapy? How did you start? And for me, it was a personal one that really led to where I am today in opening up Renew Health, the best pelvic floor therapy practice in Western Massachusetts. And it's fueled all of my decisions in terms of where we are with Renew Health and even PelviPreneur. And I just wanted to share a little bit about my journey with you guys.